many of the ophthalmologists across the country. Via AIOS, he has helped many of them in the past. And he will be speaking about consent in ophthalmic practice. Over to you, Dr. Deshpande, sir.
The consent means to agree the same in the same sense. So whatever you are telling, the patient is agreeing to the same in the same sense. It is not taking otherwise also. Patient is not something understanding and you are telling something. So it should be valid only if given. So consent can be given for anybody, but it should be valid in the court, and for that purposes by an adult it should be given by a sound mind person. So he should not be certified as a mental person or mentally ill person, by a sound and mind person. In case of minor or unsound person, by guardian. In case if he is unsound or he is a minor, then the guardians will be giving the consent. The guardians may be parents or somebody else also. Before obtaining a consent, the patient should be informed about the nature of the condition he is suffering from. So first of thing, what from you are suffering, you have to tell the options of treatment available and what options are there, alternatives are available for your treatment, the advantages and disadvantages associated with the complications and the medical risk associated with each modality of treatment. And then you should say what are the disadvantages, what are the complications in each modality, that is alternative modalities also, and how you are giving the best treatment, you have to tell them. The written informed valid consent in patient's language, that is most important, because that should be in the patient's language so he can understand better, or he should understand. Better to take informed consent under the surveillance of the camera and recording of the voice. Nowadays it is very easy to take the consent on the surveillance, so he may not be able to say in the court that consent was not taken, I don't know where I have signed, he has said me to sign and I have signed. So better you have to record his signing, and also when you are talking. Keep the record of the consent as a hard copy of the consent from, and a video of taking of the consent in soft copy, because all these things are required in the court, because you have to show that you have not done anything wrong with the patient. The types of the consent, as everybody know: free consent, valid consent, informed consent, express consent, implied consent. If appropriate consent is taken, doctor is saved from the criminal cases under section 304A. That is very important. From criminal cases he will be saved. Free and valid consent, when a patient is or his guardian gives his consent to the proposal given by the medical expert, he is deemed to have given consent. So whatever you are suggesting, they are accepting, that is the consent. It should not be under influence, mistake, fraud, coercing or misrepresentation. When a consent is given by a person who is of sound mind and competent to enter into the contract, such consent is considerable as valid consent. So that is should be there, it should be valid consent. The consent does not give total immunity from being held negligent. If you have given the consent, it doesn't mean that he has given the consent for doing the negligence by the doctor. So negligence is always different from the consent. So in consumer courts, the consent is not going to protect you, because the consumer case is based on negligence and not on the complication, and you are taking the consent of the procedure and complication. The patient signifies to undergo the risk of association with procedure for which the consent is obtained. If complications ensue or risk materialize due to the negligence of the surgeon, consent will not protect the doctor. So consent doesn't mean that doctor should do negligence with the patient. That just because the patient has given consent for an operation does not give total immunity from being held negligent. The consent indicates the readiness of the patient to undergo the operation with all ending risks. So whatever risks are there, they are covered, but negligence is never covered. A valid consent not only protects the doctor from civil liability, but also criminal liability, section 87 and IPC code. So in emergency cases, When the surgeon comes to the conclusion that an urgent operation is required, but the patient is not willing to consent for the same, then it is advisable to obtain a written statement from the patient that they are not ready for the operation and they will not give the consent to the operation. If it should be duly attested by him and his relatives or attendants, preferably under the surveillance of the camera, because this is very important. At that stage they are not ready for giving the consent, but afterwards they blame, and this is the decision given by the Supreme Court and National Forum, that the consent should not be in form, that is printed form, but printed form particularly for AIOS. We have published a booklet in which what type of consent should be taken for particular operation. For each and every operation, consent is there in AIOS booklet. So just print out that and fill the gaps there. That is accepted in the court, but the consent form which are there for general surgery, gynec, operation, ENT, and that is not accepted by the court. Thank you very much.